of Litesprite, a therapeutic gaming platform. I'm excited to share how we have inspired and empowered the underserved communities to take care of their mental health. We've been on AWS platform since 2014, so we were one of the first digital health solutions to use cloud technology. We chose the platform because of its ability to scale and its HIPAA compliance. Based on a decade of clinical research at leading institutions, we are part of a new field that I define as healthcare entertainment. Our platform is made up of two components. We have self-help tools in the form of clinically validated games, clinically validated games that collect data. The data generates analytic insights, which is used by healthcare providers, insurance companies, and employers to support patients. I don't know what's going on. Yeah, it's
advancing.
And I'm trying to hit back, and it keeps going forward. Okay, sorry about that. So the analytic insights are used by clinicians, insurance companies, and employers to support patients, members, and employees. Litesprite, our clinically validated mental health video game, is safe, fun, empowering, and proven to heal. Oops, now it's going the other way. We are reimagining mental health support and changing the paradigm of a digital health intervention. Our clinical validation translates into a person being active 2 more days each week. And we can reach those individuals that their approaches will not, such as therapy. We are also one of the first digital health solutions that has several ways for a clinician to get paid for implementing Litesprite. For these results, we are the only video game that has been recommended by clinicians, insurance companies, and municipalities nationwide. We've won over 30 global health innovation awards, including the first video game to win a US Surgeon General award. This is Suzette. She's a typical Litesprite player. She's a Medicaid patient in Indianapolis. She has several behavioral health conditions, along with several physical conditions. On top of that, she's the primary caregiver for her adult autistic son and her grandchild. So you can imagine her life is incredibly stressful. In Suzette's area, there's an acute provider shortage, so it can take her weeks, if not months, to be seen, well past when she needs help. Litesprite works for Suzette because it's a choose-your-own-adventure game based on a commonly accepted psychological framework. This gives her control over the experience while she improves her self-efficacy and self-awareness. An important part of the experience is Socks the Fox, the game's hero. Socks provides critical emotional support and empathetic care to Suzette whenever she needs it, whether it's for a few minutes during a small break in the day or at night when she can't get to the ER. And as a result, she's credited us with saving her life multiple times. Because we meet people where they are, we have helped nearly 10,000 people from all walks of life. We've brought joy, changed mindset, inspired, and helped with loneliness in underserved communities. The underserved population finds the game format particularly appealing because it's non-judgmental and it's interactive. We've designed the game as a micro-intervention, so it only takes a few minutes a day for a person to realize results. We've been selected by community leaders and patient advocates to serve underserved communities in New York City, Kentucky, and Arizona. And now, with the support of AWS and the Health Equity Initiative, we will be working with supporting the mental health of Native American youth through our partnership with Rise Above. We deliver immediate support, so we scale healthcare. And this is critical for any organization working with underserved communities. There is a growing provider shortage that is creating an ever-widening care gap, and thousands of people are experiencing pains like Suzette, and the number is growing rapidly. As part of the GAIN experience, we collect clinical screens for anxiety and depression. We also collect important data that gives insights into a player's emotional state as well as activity, and this is something clinicians do not have access to today. So this allows them to remotely monitor patients even between visits and identify those that need higher levels of care. And the data is so unique that AI models can be used to build predictive models and identify individuals who are at risk for suicide. We've worked with patients who have PTSD, anxiety, depression, bipolar, and substance abuse. And I'm looking forward to delving further into how technology can scale care. Thank you.